Hello, I'm Kathleen Alejandro with Liberty University. This is my health assessment head to toe nursing 505 final assessment. I have with me in the corner Dr. Williams, who is my proctor, and my patient volunteer is Annie Durock. So we'll go ahead and get started. So I'll begin with the skin assessment. Right now I'm just looking for any abnormalities, including color, skin turgor. I'll make sure that she's not dehydrated. On the upper extremities, I'm looking at her finger and fingernails for any clubbing, any edema, any lesions of the fingernails, making sure it's adhered to the nail bed appropriately. Everything looks good. I can also check capillary refill while I'm here. And no edema noted. Moving on to the lower extremities, the same thing. I'm looking for color, skin turgor, cap refills, looking for edema. I'm not seeing any abnormalities, any skin lesions, any redness, any skin breakdown. Moving on to the head, I'm also assessing for symmetry, looking at the head and scalp, looking for hair distribution, making sure that the size is appropriate, the skin is appropriate for her race, hair distribution is normal. I'll begin to palpate the head and scalp as well. Looking to see if there's any malformations or tenderness on palpation. Everything's normal there. I'll go ahead, since I'm already back here, and palpate the cervical neck for any tenderness on palpation. And moving on to the face, I'm going to palpate her face as well and around her eyes, looking for any tenderness. Paranasal sinuses, her jaw, since I'm here, if you can open and close your jaw for me, good. I'm looking for any clicks, any dislocations, any pain or tenderness on palpation there. There's nothing noted on her jaw as well. Good. And now I'm just looking at the hair distribution on her eyebrows, making sure that they're symmetrical and that her eyes also are even and symmetrical, nothing obvious with drainage anywhere in her face, any lesions or anything like that. And I'll go ahead and test the cranial nerve for the olfactory sense. And I'll give you something to smell. If you would close your eyes for me, close one nostril, and let me know what you smell here.
Alcohol.
Okay, if you can turn the other nose, yep, switch, and tell me what you smell here.
Alcohol.
Exactly right. Okay, so that cranial nerve is intact. And I'll go ahead and have you just do some facial movements for me. If you could raise your eyebrows really up and then clench your eyes really shut. Don't let me open them. Good, relax, and puff your cheeks up for me. And clench your lips together. Yeah, good. And smile, big smile, show your teeth. Excellent. And stick your tongue out for me and move it side to side. Great, okay, relax. And now I'm gonna move on to the eye exam. And at this time, if I had a Snellen eye chart, I would move on to that. A Snellen eye chart, I'd have her stand up. You don't wear any contacts or corrective glasses? Okay, if she did, I'd have her do the Snellen chart with her corrective lenses. She'll stand 20 feet away from the eye chart, and with both eyes and then one eye at a time, we would test her visual acuity that way with the lowest line she's able to read. Also, there's the option of the Rosenbaum test, where she'll have it 14 inches away. And just read me the lowest line, and that'll test her near visual acuity. Next, we would do, I'm going to test your pupils. So I'll get my pen light, and what I want you to do is just look at the wall behind me first, look at me and my nose, look at the wall behind me, and look at me and my nose. Good, and I'm just looking to see if her pupils will constrict with the distance, focusing on something distant and something near. And now I'm going to just shine a light in each of your eyes and see if your pupils will constrict consensually and individually. Great, other side. One more time. Excellent. And now what I'll have you do is just watch my pen light here. We'll do the 6 cardinal vision of gaze. Follow the pen just with your eyes, not your head. Good, almost there. Last one. Excellent. Again, watch the pen. It's going to get right close to your nose. Follow it with your eyes. Excellent. Everything looked appropriate there. And now I'm going to go and take a look at your red reflex. So I'm just going to dim the lights real quick. Shouldn't be too dark. And all right. So I just want you to stare at the wall right behind me and just remain fixed there. I'll start to see red light, reflex is present. Now I'm just going to touch your shoulder just so I don't hit you. And you just keep staring right straight ahead. And ideally, I would have a step stool. I actually think I can't. Okay, don't mind me. I'm going to get pretty close to you, okay? I'm short. All right, here we go. And here I'm just looking for the optic nerve. I'm looking at her retinal vessels to make sure that they don't show any signs of hemorrhage. Looking for the white light at the macula. Everything looks good. Let's test the other eye. Same thing here. You just keep staring at that wall, and if any of this makes you uncomfortable, just let me know and I'll stop. And same thing, looking at the optic nerve, making sure the disc is appropriate in color, shape, and size, and that the retinal vessels are not inflamed or show any signs of hemorrhage. Good. Okay. The other thing I wanted to just note as well is the color of her sclera. Let me turn the light back on since we're done with that. Making sure that the sclera is white. The conjunctiva, I'm just going to lower and look, is pink and appropriate, and the top lid as well. Good. I don't see any drainage or any exudate noted. Palpating the lacrimal sac to make sure there's no tenderness or any drainage as well. Good. Moving on to, let's do the nose next. I'm going to look at your turbinates. We've already tested the patency with that smell test as well, so I just want to take a peek and make sure that the drainage is normal as well. Good. No evidence of any drainage. Just clear, normal. No evidence of a deviated septum. Good. And if you would block one nostril and take a breath for me, and other side, do the same thing. Excellent. So patency is intact. Next, I'd like to move on to your mouth. I'm going to put my gloves on. And if you would open your mouth for me, I'm going to grab my pen light again. Open your mouth for me and say, ah.
Ah.
Good. I see the uvulized midline. There is no evidence of exudate, swelling, lesions. Hard palate is intact and normal. Gum line, I'm just going to move around here and check. Good dentition. I don't see any obvious caries or broken teeth needing my attention. If you would stick your tongue out again and just move it to the top of your mouth. Just checking her frenulum. I'm going to see at the top of your lip, the frenulum up here. Good, and at the bottom. Good. Moving on to your ears. Let me put a new tip on this. Moving on to your ears, I'm going to inspect the external structures of the ear, making sure that I don't see any obvious malformations, drainage, no obvious redness, really anything that's alarming. They are even on both sides, symmetrical bilaterally, and now I will take inspection internally and see here. Pulling the ear up and back. I'm taking a peek at the tympanic membrane,
Making sure I see a pearly gray color, no evidence of any cerumen buildup. I don't see any evidence of any impaction or any lesions or any bleeding either. And I'll do the same thing on this side here. Pulling the ear up and back. And again, I don't see any evidence of abnormalities. Tympanic membrane is good. Pearly gray color and appropriate. Okay, moving on to the ear still. We'll do the whisper test. You'll hear me whisper 2 words on each side, and I want you to just let me know what it is, okay?
Apple. Dog. Cherry. Cat.
Good. While I'm here, we'll also do the Weber and Rine test. You'll hear some vibrations. I want you to tell me if it's even on both sides, okay?
It is even.
Okay. Now I'll do it behind this ear. Let me know when you stop hearing.
No.
Let me know when you stop hearing.
No.
Good. Same thing on the other side.
No.
And again.
No.
Good. So that just tested the bone conduction versus air conduction, which showed that the air conduction is greater than bone conduction, which is a normal finding. So that completes the ear assessment. I'll move on to checking your lymph nodes. I will palpate starting at the back of the head and underneath the jawline here, and then moving down to your jugular nodes, one at a time here, and sternocleidoid, and the clavicular. And I don't palpate anything that's swollen, really. Moving on to the neck, I'm going to palpate your carotid artery, one at a time, 2+ on each side. And since I'm palpating, I'm also just going to make sure that the trachea is midline, but I'll palpate while I'm here. I'll have you swallow for me. Good. And I'll come from behind here as best as I can and just palpate the thyroid, making sure it's not swollen at all. Good. Now since I'm here, I'll take a listen also to your neck, listening with the bell of my stethoscope for any bruise of your jugular and your thyroid. Excellent. Okay, I'll take a minute to make sure I've completed the head, the eyes, the nose, the mouth, the ears. Yes, so moving on to cardiovascular. In a real patient scenario, I would visualize the chest with no clothing on, but for the sake of this demonstration, we'll keep her clothes on. But I would be looking at the chest and noting not only any lesions on the skin, but seeing for any abnormalities of the chest. While I'm here, I can also look at equal chest rise and fall, just making sure I don't see anything that's obvious abnormality. And then I'll go ahead and start palpating. So first what I'll have you do is just lay down for me. I can get this down. Okay.
Okay, and I'll get you to kick your legs back. Okay. And I'm just palpating and here at the point of maximal impulse, what I'll have you do is lay on your left side for me. Feeling for her pulse here. Great, and you can rest back. And now I'll go ahead and auscultate. Here I start with the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. Excellent. I didn't hear any S3, S4 sounds, any gallops or murmurs. So everything is normal and appropriate there. And also for cardiovascular, part of this assessment will be to assess the pulses. So I've already checked your jugular, but I will go ahead and check your temporal pulses. Good. Moving on to your brachial. Moving on to the other side. Good, 2+ so far. Radial pulses. I'll reach over and do this one simultaneously. Good. Moving on to popliteal. 2+. 2+. Posterior tibial. And dorsalis pedis. Good, appropriate. No edema anywhere throughout the exam. So I would say that completes the cardiovascular assessment. Moving on to respiratory. I will have you sit up for this one for me. Oh. And here I'm just going to visualize the chest for equal chest rise and fall, making sure everything is symmetrical bilaterally, that nothing stands out abnormal before I get to palpating. And in palpation, I'm going to palpate anterior and posteriorly to see if I have any tactile fremitus. So every time you hear it, you feel me touch you, I want you to say 99, okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Excellent. I'm also gonna percuss your lung fields and make sure that I don't have any abnormal dullness. Sorry, excuse me. And now we'll get to auscultating all of the lung fields. You'll be taking a lot of breaths for me, okay? Go ahead. Same thing on the posterior.
Excellent. So everything was clear bilaterally. I didn't hear any sounds of crackles, bronchis, or really any abnormal adventitious sounds. Another part of this exam is the diaphragmatic measuring, and for that test I can just talk through. What we would do there is on her back posteriorly, I would ask her to take a deep breath and exhale and hold it. I would percuss to see the area of dullness, at which point I would mark it with a pen, have her take a breath, and as soon as she catches her breath, I'd have her hold it at the inhale. As she holds the inhale, I do the same thing and I percuss till I feel the area of dullness, at which point I mark that and I measure the distance between those 2 points, making sure that they're within normal range. Standard would be about 10 centimeters. Moving on from the respiratory assessment, I would start the abdominal assessment. So for this, I would have you lay down for me. I will pull open. Go ahead and kick your feet out. Again, starting with the inspection of the abdominal region, making sure that I don't see any abnormal pulsations, no evidence of ascites, any sort of inflammation or distension of her abdomen, any tenderness upon asking. And, you know, if everything is negative, which everything appears to be normal, I would go on to auscultating. And so I'll auscultate the abdomen for bowel sounds. All the bowel sounds are intact. I'm also going to take the time to auscultate with my bell the abdominal aorta, the liver, the kidney arteries, and the splenic artery, and just hearing if I hear any abdominal bruits or any abnormalities there. And I'd also listen to the femoral arteries for the same. Okay, no evidence of bruits, everything is within normal limits. Now I'd go to light palpation of the abdominal wall. Just checking for any tenderness on palpation, nothing hurts. Okay. And now I'd move on to deep palpation, and now I'm really trying to get a feel for the organs in this area, particularly the liver borders, assessing to see if they may be inflamed or enlarged. I look at the intercostal margin here, and I really kind of cuff it to see if I can feel for the liver. Let me know if I hurt you. I know it's uncomfortable. Yep, right at the border here. And if I wanted to test the size of the liver, they have the scratch test too, where I would auscultate and listen for when I hear that scratching sound appear, and then when it disappears would be the top edge of the liver. Then I'll have you sit up for me so I can just check for CVA tenderness. I'm going to tap on your back and you let me know if this hurts. Any pain?
Mm-mm.
Excellent. So no CVA tenderness, that tells me her kidneys are doing okay. As far as the abdomen, that would complete the abdominal assessment. Of course, I'd ask about bowel movements just to make sure things are okay in that department. And then moving on to musculoskeletal. So here I would palpate the upper extremities, just feeling for any clicks or abnormalities of the joints, any pain on palpation.
With the fingers, I'm looking at the joints, but also I will test mobility here. So if you would just open and close your fingers and spread them laterally like this and close them. And now I'm gonna hold them tight and you open. Try to open against resistance, okay? And now we're gonna do the opposite. You're gonna close, try to close them against my resistance. Good. And we're gonna do the same thing over here. I'm just gonna palpate and open and close your fingers. And this way, and against resistance. And the other way. Good. And now you're going to squeeze my fingers nice and tight, 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 tight. Good. Awesome. And let me palpate here on this arm here. Same thing. And as I assess, I'll also do range of motion. So lift up your shoulders against my resistance here. Excellent. That tests one of the accessory muscles, the spinal accessory cranial nerve number 11. And with your shoulders, go like this. Excellent. Now I'm going to put some resistance and you do a bicep curl and I'll try to resist you. Good. Oh, you're stronger than me. Okay. And now opposite way. Push against. Good. Excellent. And now put your arms all the way up. Good. And relax them. Excellent. And now wrist range of motion and side to side. Excellent. Okay. And now we'll move on to your knees. Go ahead and push out against me and pull in. Excellent. And now up.
Oh,
Yep, raise them. Yep, you can do one at a time. Excellent. And now we're going to go down against my resistance. Push down. Good. Other side and push down. Good. And now with the feet, you're going to do the same thing. Put them up, put them down. And now we're going to do the gas pedal thing. So you're going to, like your, yep, gas pedal and now up against my feet. Yep, good. And now crunch your toes. Good. Any pain with any of that? Do some rotations of your ankles for me. Excellent. Good, good, good. All right. Now we're going to have you lay down. We're going to test your hips. Okay. Pull this table out here. Okay. Stretch your legs out. Might actually lay you down a little bit more to make it easier for you. Okay, go ahead and lay back. What I want you to do is kind of cross your legs over one another. Excellent. Good. Any pain with that? Excellent. You can sit back up for me. What I'll have you do is stand up, and within the field of this camera, if at all possible, you can stand over here maybe, and you can face that direction. I want you to try to touch your toes for me. I'm looking at your spine to see for alignment. Good. You can come back up. And no evidence of scoliosis there, and range of motion of the hips are intact. I want you to bend back as far as you can. Good. And now side. Wow, you're flexible. Side by side, if you could. Great. Great. Okay, you can have a seat back over here on this table for me. And now what I'll do is test your rapid movements. So let's do your hands. What I want you to do is up and down, up and down, up and down on your lap. Excellent. Now I want you to touch your fingers. Good. And now I want you to close your eyes. And with one finger and one finger only, you're going to touch your nose. Touch my hand right in front of you. And again, really fast. Good. Now switch fingers, other hand. Same thing. Excellent. Good. All right. Let me see. All right. Now I want you to take the heel of one foot and touch it to the shin of the other leg and run it down. Good. And the other side. Run it down. Excellent. Okay. Now I'm going to test your reflexes, your deep tendon reflexes. Yes. Okay. So starting with the tricep one, I want you to relax your arm, the weight of your arm on me here. Let me know if I hurt you. Let me go with this. There it is. Okay. And relax. So do the bicep one. There you go. Good. And radialis. Good. And we'll do the same thing here. We'll switch hands. I'm a lefty, so this might be a little awkward. Try that again. There it is. Okay. And the brachial. There we go. And the radial. There we go. And now I'm going to do your knees. Pants are thick, so I probably have to strike a little harder. There we go. And on this side. So now I'm going to have you lay on your belly on the bed. And we'll do your ankles. I'm going to pull this out here. Yep. And here we go. There we go. All right, you can sit back up for me. Let me just sit back up. And just running through my head, making sure I hit all of the points of this exam. Let's have you stand up one more time and do the walking test just to make sure your balance is intact. If you could just walk to that wall and back, just making sure her gait is steady and she doesn't have any balancing issues. Good, and I'll have you stop right there and we'll do the Rosenbaum test. You just close your eyes and stand nice and still for me. I'm making sure she's not swaying excessively or have any balance issues. Excellent, you can have a seat for me. And I would say this completes my assessment. Any questions?
No, ma'am.
Okay,